Hey y'all, welcome back to my channel. I'm Muriel, this is Nurse Muriel. Welcome to my new subscribers. I'm Muriel. I'm a registered nurse and I prefer long-term care. To all my oldies but goodies, hey, how y'all doing? Welcome back. Welcome back. So today y'all, don't have much to talk about. I'm at work doing a 7 A to 7 P. I'm on my lunch break. Y'all know I got my little lunch tray here, steering wheel lunch tray here. And I thought about I was talking to a friend yesterday and she was saying you know how people in the community talk about different places, especially in a small town. The place that I grew up was a small town, very small town. I think it has less than like 8,000 people. And so it's one of those almost like where everybody know everybody. That's one of the reasons I had to get from around there, because it's just like that everybody knew everybody at the age I was then. I stayed in a lot of drama, not always attributed to me, sometimes family members. Then when I had my children, as they were getting older, they were in drama, and it just got to the point where the people so small mind, like they small minded. Even the ones who are supposedly intellectual, smart, go to school, do all that, they still fell into those small town, small mind ways, like the way they think. Something about the way they think, y'all. When they say stuff, and I'm not saying because it's in the South, because I grew up in the South, but it's just something about this go along to get along mentality. The small town, I don't know. It's just something about it. I guess because it's not enough going on in the town per se itself, that everybody just minds everybody's business. So the facility that I go to work to there, the one where I said the patients were spoiled, that facility had a bad reputation when I lived there, and that's why I never went to work there, because it had a bad reputation. The town is so small that it only has 2 long-term care facilities in the whole town, and 1 assisted living. But I worked at one of the long-term care facilities, and when I wanted to switch jobs, I would go to a whole nother city or whatever. I never went to that other one because it had such a bad reputation as far as the workload. Anyway, one of my friends said she was talking to somebody who works there, and she was talking to a social worker, and she was talking to a housekeeper that worked there, and they were talking about the CNAs, y'all. This is what tripped me out. They were talking about the CNAs. Talking about how these new CNAs so lazy. They don't want to take care of the people. They just there for a check and all kind of stuff. I work there too. I don't work there full time. Y'all know at one point I was going there real often, like 3 times a week. Them CNAs work hard in that facility. I'm not going to say all of them do, because there's one particular floor that, for some reason, that culture, they'll see in that floor. A lot of the day shift CNAs I'm not going to say a lot. It's like 1 or 2 of them that I've worked with that you really have to stay on top of them to get them to do things. But for the majority in that facility, CNAs work hard. They work hard. And for her to say that they were talking about the CNAs just here for a check and this and this, it shocked me, y'all, because the social worker herself used to be a CNA there. When I tell you, I worked with her a couple times. When I tell you have no room to talk, when she was telling me what this social worker was saying, now mind you, this social worker, she just became a social worker probably about, I want to say maybe about 6 months ago. She finished school, but she was a CNA prior to that. And y'all, when I work with her, you talk about lazy. You talk about lazy. But then turn around and talk about these CNAs just here for a check. These new CNAs. And the CNAs I work with, y'all, some of them are young. Like, they're the children of people I went to school with. They're young. They're like in their early 20s, mid-20s. They're young. Them girls at that facility, because that facility be on top of stuff. Like, I'm going to tell you, that's, as far as being thorough, they're a little too thorough. They're a little too organized. They be on top of stuff. When she told me that they were sitting there talking, I was like, I know better. They can't be talking about that facility because them girls work hard. Them girls work hard. Now, if they were talking about this facility where I'm at now, then possibly I would believe it. But there, no. But what got me is she said the housekeeper said that she went into a room and one of the patients was soiled all the way up their back. But she just went in and cleaned the room and dumped the trash and left because she doing a job that she got paid to do because them CNAs think they better than the housekeepers. They better. Y'all, I ain't never heard no foolishness like that in my life. I've heard they say the CNAs say the nurses think they better than the CNAs. But y'all, she said the housekeeper said the CNAs think they better than them. At what point are we just going to accept? At what point people are going to accept that it's not necessarily people think they are better than you because they achieved a position that is seen in society as a step above? It's not that people think they're better than you. It's that you feel some type of way about the position you are in life. And it's natural. And there's nothing wrong with it. There's nothing wrong with wanting to achieve more in life. There's nothing wrong with not wanting to stay where you are in life as far as finances, education, social status. There's nothing wrong with not wanting to stay where you are. The problem comes in when you start to think that everybody else who has a position that is seen as a position above yours, for some reason, think that you are inferior to them because of the position they play. When are we going to accept that? It's not that people see you as inferior. It's that you see yourself as inferior for whatever reason. Let me tell you, I was an LPN for 18 years. When I became an LPN at 22, 23, when I went to work in the hospital, I told y'all I didn't have a good experience because as an LPN in the hospital, I don't like asking people to do things for me. I want to be able to do them myself. Now, I know there are times you will have to ask, but normally if I'm asking for someone to do something for me, it's going to be some type of monetary compensation involved. So there's no feelings either way. And even as an LPN in the hospital surrounded by RNs at such a young age, I never felt that the RNs thought they were better than me. I just felt that the RNs got annoyed if I forgot to ask them to do something that I couldn't do, like an IV push, start a blood transfusion, something like that. We were supposed to let them know ahead of time. And then they would catch an attitude because I came to them last minute for it. And so I left the hospital because I didn't want to ask people, whatever, to do things for me. I wanted to be able to do it myself. So I said if I ever return to the hospital to work, I would return as an RN. And that's what I did. Even though it took 18 years, that's what I did. I didn't return to anyone's hospital until I got my RN. I never felt inferior as an LPN to any RN I came across. Especially if I came across a black RN, because y'all know those were very rare. When I would come across a black RN, I would be so proud. I would be so proud. There was nothing that the RN could achieve that I couldn't achieve except for certain positions in the place that we work. But they were positions that I never wanted anyway. Even to this day, I don't want those positions. And I'm more than qualified for quite a few of them. But I never felt inferior. Therefore, I never felt that they felt they were better than me. Let me tell y'all, when people get their RN, I got my RN. I've been an RN now for 4 years. I'm not looking at any LPN thinking, oh, I'm an RN. She's just an LPN. Honey, I don't care what you got going on over there, as long as you're taking care of the people. The mistakes that I see that I complain about that happen in the facility that I work, these are not mistakes that only the LPNs are making. RNs are doing this too. So that did something to me when she said that the housekeeper said the CNAs think they better than her. I'm like, when people gonna admit her? Let me tell you, I work with them CNAs. Them CNAs ain't thinking about. They ain't thinking about us, the nurses. They ain't thinking about the housekeepers. They just focusing on doing their job. They not worrying about you. Trust me, they ain't not worried. At that particular place, they ain't worrying about you. Most of the places I work, the housekeepers and the CNAs get along very well. For whatever reason, the CNAs seem to cling to the housekeepers and dietary more than they do interact with the nurses. My mama told me to stop eating on camera, y'all. but y'all, I really got upset about that because I work there and I know them CNAs work hard. Them CNAs do their job there. That's one of the few places that I've worked in my entire 23 years that they'll see 22, however long, where the bulk of the CNAs do their job. Y'all, we got to stop. And people won't admit it, but you have to stop feeling inferior to other people just because they have a certain type of status. You got to stop feeling that people look down on you. That LRNs looking down on LPNs, honey, 95% of the time, that's all in your head. No one's looking down on anyone because they're anything. We happy. We just happy we was able to achieve it. We ain't trying to knock you from getting it. And sometimes, I know there are lazy nurses, there are lazy CNAs. I work with lazy nurses, and I work with lazy CNAs. But if I, as a nurse, ask you to do something that's in your job description, that doesn't mean I'm asking you to do this because I'm above you. I feel like I'm above you. I feel like, no. More times out of 10, I'm asking you to do it because it's in your job description. I'm busy at the time, or I've seen you be lazy the entire shift. So when there's something that needs to be done, I'm going to ask you to do it because you haven't been doing much of anything the entire shift, y'all. I just wanted to talk about this because it really made me upset. I was like, why are they talking about the scene? I was mad. I was like, and she was on, and then my friend was on the phone. She was like, I don't know, because my mama used to work at a facility years ago, and my mama told me that the CNAs did the residents wrong, and I don't never want to be put in a nursing home. And I told her, yeah, there are CNAs like that. I'm not gonna lie to you. There are CNAs. And then I told her something else that I noticed. The CNAs that talk rough to patients be the older CNAs. It don't be the young ones that I noticed. The young ones be laughing, joking, having a good time with them. It be them older ones. And I'm 46, and I'm saying older than me. Some of my age be talking to the residents all kind of ways. Like, you would never think they were had a professional career the way they talk to the resident. And I noticed that even when I was younger and I was a younger CNA, I noticed it was the older CNAs that talked to the residents all kind of way. It wasn't the younger ones, y'all. It wasn't the younger ones. A lot of people need to come to the realization that it's not that people think they're better than you. It's that you, for some particular reason, at that particular time, feel inferior to the next person. It's not that they think their act or whatever like they're superior to you. You feel inferior because of the choices that you made in life. Don't put that on the next person, y'all. I said I was going to talk about my trash business. I ain't going to talk about my trash business, y'all. We went and delivered them cans. Oh, my goodness. My friend, y'all. I be wanting to talk relationship stuff on here. He be getting on my nerves. I used to let things build up and build up and build up and build up in me. And then when it explode, it just be like fight time. Like, people want to fight me for the things I say. So I stopped holding things in because it really festers in me. Like, it makes me angry when I hold it in, and I don't want to do that no more. So I was feeling that way about him last night, and I had to tell him, I said, I'm starting not to like you as a person. And when I told him that, I felt so relieved. And He didn't like it. I know he felt some type of way when I said it. He told me basically get in line with the rest of the people that feel that way about him. And then today we talked, and I have no regrets about saying it. I don't have no regrets about saying it because I had to say it to make myself. Sometimes they say you need to hold things in, but I feel like communication in a relationship, in any relationship, you have to have communication. I really need to tell him that last night because he was really working my damn nerves. So yeah, y'all. Like I said, I be wanting to talk relationship stuff on here, but I don't know. Maybe when I start like members doing member channel, y'all join the members thing or whatever. We'll do relationships on there. I want to keep it strictly nursing. But my friend be getting on my nerves, y'all. He got so many qualities that I love about him. Absolutely adore. I love the countryness in him. I love we'll put on a pair of overalls and go places. Like, I love that type of stuff about him. I love that he get up and go to work. And it's just like he feel like that's what he should do. But other things, ooh. Anyway, I'm Muriel. This is Nurse Muriel. I'll see y'all on the next one. Bye.